Hello everyone, my name is Dr. Christian Molstrom, and I am a supervising physician with Legacy GoHealth here in Portland, Oregon. And I wanted to talk to you today briefly about urgent care in the emergency department and making that decision about when you should go to one place versus the other. Okay, so I want to try to make this simple. This can be a complicated decision even for doctors. So I'm going to boil this down into 3 points that you should consider. So the first thing you should think about is kind of what's going on with me. Well, that seems pretty common sense. But if you've got a problem with your lungs or your heart or your brain, then that should make you think that this is probably an emergency department kind of issue. All right. I'd also put in that category severe pain or extensive bleeding. So again, lung, heart, brain problem, extensive bleeding or severe pain, start thinking about the emergency department. Not necessarily 100% of the time, but let's say that's kind of where you're heading. Now the second factor you should consider is your age. Are you on the extremes of age, meaning say under 6 months old, over the age of 65, or over the age of 80? Are you sort of what we would say young and healthy, younger in our medical terminology? And then the third characteristic I want you to consider is ask yourself, are you somebody who doesn't have any medical problems, don't take any medications, or are you somebody that has a fairly extensive medical history? You've got chronic conditions such as obesity, diabetes are common ones, you're being treated for cancer, or you have HIV. Those are the sort of things which will certainly make your diagnosis more complicated, and also your risk of having sort of a bumpy road down the line is higher as well. Okay, so let's take some examples of things that we see, and I see these every day here at Legacy GoHealth Urgent Care, and also in the emergency department that I work in. All right, so we're going to start off with 5 things, it might be 6, but 5 or 6 things which I think almost always should go to the emergency department without thinking, regardless of age, regardless of your medical background, and that's confusion. I really think that should always go to the emergency department. There's just too many things that can be going on with confusion. Respiratory distress should also be just seen directly in the emergency department. Severe pain, and the reason for the severe pain is that generally it's very likely that you'll need to have an IV placed, and that's best done in the emergency department. Any kind of limb paralysis should go straight to the emergency department, and then a severe or new headache. And we all of us have had headaches, and we all have that worst headache in our life, so it really need to think about, is this something that's really, really severe, it's unusual, and that should be seen in the emergency department as well. Right. Now, why those conditions in the emergency department and not urgent care? So the emergency department, the big difference is that the emergency department has got a wide range of tools available to make diagnoses. So advanced imaging, CT scans, ultrasounds, MRIs, there's consultants, specialists, surgeons available on hand. You are more likely to see a specialized trained physician in emergency medicine. The ancillary staff, nurses, and respiratory therapists are all trained to deal with these more acute and serious conditions. All right, so some other conditions that we see in urgent care and also in the emergency department that can kind of go both ways. I would say a really big one that's can be challenging for everybody to sort out is chest pain and abdominal pain. And this is where I would say, well, think about the other things that are going on. Like, are you in the extremes of age, and do you have a lot of other medical conditions? So if you're 21 and you're having some chest pain, maybe because you've got some asthma, you could probably go to urgent care in that case. But if you're an 80-year-old with chest pain, that should really just be a visit to the emergency room. You're going to need some tests that the most urgent cares are not going to be able to perform for you. Fever, I think for the most part, most people can be initially seen in urgent care. However, if you're a parent and you've got a newborn with a fever under 2 months of age, that that patient needs to be seen in the emergency department because there are just additional tests such as a lumbar puncture and blood cultures that are highly recommended. You obviously can't do those in urgent care. Urinary tract infections, the vast majority of these are perfectly diagnosable and treatable in urgent care, and that's a great place to go as a first stop. Cough, cold, sore throats, come on into urgent care, happy to see you. Sprains, even severe sprains, urgent care, you don't generally need to see the emergency room for those. Sometimes sprains are actually fractures and you don't know. So I would say, ask yourself, is there a really large deformity there of your arm or the ankle or foot? And if there looks like a really large deformity, there's a good chance there's probably a fracture there that really needs to be straightened out. And those can be very painful, and the patient might need to be put to sleep temporarily for that, for comfort. Most urgent cares cannot do that, so that would also be an emergency department. But minor fractures that really don't need much straightening out can be handled perfectly well in urgent care. Lacerations, minor cuts can be managed in urgent care, with the exception if it's a large deep cut and there seems to be loss of function, say of the hand, or there's a lot of blood, that probably should be evaluated in the emergency room. And then lastly, so those allergies and rashes, I see a lot of these at Legacy GoHealth in urgent cares, and I think the vast majority of these are okay to see in urgent care. However, if you have trouble breathing or you have any swelling up in your mouth here, tongue, even the lips, feeling like you've got swelling here in your throat, that could potentially be a serious condition affecting your breathing, and that's best seen in the emergency department. All right, so to summarize, I have 3 points that I want you to think about when you're trying to decide if you should go to the emergency room or urgent care. Number 1 is, what is going on with me? Do I think something's going on with my brain, my heart, or lungs? Do I have severe pain, or do I have a whole bunch of blood? All right, some of that's pretty common sense, and you should be thinking, okay, yeah, to those questions, think about emergency department. The second thing is that, am I in the extremes of age? All right, the extremes of age I think would be, say, under 6 months, and then generally in the medical literature we say over 65. All right, and then the third point is, do you have a complicated medical history with chronic conditions, or are you a relatively healthy individual? So if you're a yes to all 3 of those, you need to go to the emergency room. It doesn't mean that you have an emergency condition, but it means that you're very likely that you're going to need tests and observation that just can't happen practically in the urgent care setting. Okay, so again, my name is Dr. Christian Molstrom with Legacy GoHealth, and signing off. Have a nice day.